Good morning, everybody. This is Brooks Wolf, and I'm with Life and Safety Consultants. And today we're joined by Anthony Wilkes. He's going to be doing most of the leading of the discussion in the webinar today, but I'd like to go ahead and get started. First, thanks everybody for joining us. We really appreciate you taking the time to be here. Today's session is on OSHA record keeping and electronic reporting. And we're going to run this a little bit more like an interview or discussion. And the idea here is to have a conversation around these topics that are most confusing and tend to cause the most issues, and hopefully make them easier to follow and give some real world examples. Just a quick reminder, today during the webinar, you'll stay muted throughout the session, but feel free to drop questions into the chat as we go, and we'll plan to circle back and address those as we go along. George Fish, who's our VP of Online Services, is also on the webinar today, and he'll be helping us keep track of those questions as they come in. And Anthony, before we jump in, can you take a minute, introduce yourself, and give everybody a quick overview of your background and experience with OSHA and OSHA record keeping?
Yes, good morning, everyone. Like you said, my name is Anthony Wilkes. I had the good fortune to working with South Carolina OSHA. I was able to retire from South Carolina OSHA after 28 years in 2023. And then I joined Life and Safety ever since 2023. My back with record keeping, we dealt with this a number of times, and this was one of the most asked questions during my time with OSHA. And I also was and I was able to review a lot of BLS data during my time with OSHA and understand a little bit more about record keeping and what the actual data means. So,
Well, great. Thanks for that. And yeah, why don't you go ahead and kick us off then?
definitely. Uh, Thanks again, everyone. So today we're going to talk, like I said, about record keeping, OSHA record keeping, and some of the electronic reporting requirements. So our agenda today, we're going to start off with talking about the purpose of the record keeping, and then we're going to discuss a little bit about employer coverage, and then some of the record keeping requirements, and then of course the electronic submission of those that section that everybody loves, that electronic submission. So to keep it simple, the basic purpose of the rule was to require employers to collect injury and illness data and report it to the government. So OSHA wanted to know what your injury illness rates were during the time of the OSHA Act. I believe it was they estimated it was over 14,000 fatalities, and then hundreds of thousands of injuries and illnesses that occurred each year. Now, the rule, the government wants their data, but it doesn't tell how the data is used or why it is important. The records provide the base data for the BLS survey of occupational injury and illnesses. That is the nation's primary source of occupational injury illness statistics. The records are also used by employers and employees to manage safety and health programs at individual workplaces. Many of the safety professionals, they have KPIs that are based on their injury illness rates, right? Analysis of the data is a widely recognized method for discovering workplace safety and health problems and for tracking progress in solving those problems. Finally, the data is used by OSHA. OSHA collects the data to direct programs and measure their performance. So OSHA used this to also measure their performance. And then also the compliance officers use the data during inspections to help direct their efforts to the hazards that are hurting workers. The purpose section also includes a note to make it clear that recording an injury or illness does not have any effect on workers' compensation, nor prove a violation of an OSHA rule. OSHA put this note in here hopefully to reduce the stigma that some employers feel accompanies the recording of a work-related injury or illness. Now, for its covered employees, of course, we know it includes all employees, and that's the salaried, your executive, your part-time. But one of the sections that some employers forget to include are the temporary employees. So you must include your temporary employees if they are locally supervised. And when we talk about that, controlled on a day-to-day basis, they may not be your employees, but OSHA looks at it that you have created an employee-employer relationship.
Hey, Anthony, I got a quick question on that one.
Sure.
If I have temporary folks at my workplace, but let's say that the agency who we're getting those temporary workers through, if they're on site and they're managing day to day, who has record keeping responsibility at that point?
If you have an agency on site and they are managing their day to day, and when we talk about managing the day to day, it's not just because they got a supervisor on site. Are they managing their direction? In most places, I look at it as, hey, you may be using our space in our building, but we tell you to make widgets. You go make the widgets. We don't get into your operations of how do you do it, who you bring in, who can be off and not off. All we want all the widgets that are coming out. So maybe then that agency is controlling their own employees' operations.
Yeah, thanks for clarifying that because I was, I've always wondered that because I've seen more and more agencies have an office there, but they're not really controlling what the staff is doing, what the temporary worker is doing. They're just kind of there on site, and I just wanted to know, so it's whoever's directing the work for that person on a day-to-day basis.
Right. Yeah, you see that a lot of time. The agency may have a person on site, hey, to keep up with the time, know who's in and who's out, basically. Mm-hmm.
Okay, great, thanks.
So there are also some exemptions under record keeping. Many, but not all employers must complete the OSHA injury illness record keeping forms on an ongoing basis. Employers with 10 or fewer employees throughout the previous calendar year do not need to complete these forms. Said another way, if there are more than 10 employees at any time during that calendar year, the employer may come under the requirement. When counting employees, though, you must include full-time, part-time, and temporary and seasonal workers. This exemption is based on the employment of the entire company rather than the establishment also. For example, if a company has two establishments, one with 5 employees and one with 7 employees, the company must fill out the forms for each establishment because the company employment is greater than 10. In addition to the small employer exemption, there's also an exemption for establishment classified in certain industries. For example, the forms do not need to be completed for restaurants, banks, and medical office. You can find a complete list of those industries that are exempt in the 1904 net appendix A.
And Anthony, just for clarification, they're exempt from record keeping, but that doesn't mean they're exempt from other regulations. They still are following all the regulations no matter what. It's just they just don't have to record.
Yes, so you are exempt from record keeping. Just because you're exempt from record keeping, that does not mean you don't have to follow all the other OSHA standards. If you have one employee, you have to protect your employees, and there are OSHA standards that you have to follow. Also, just because you're exempt from record keeping, that doesn't mean you are exempt for reporting criteria also. So, and we'll talk about some of the reporting requirements later on in the presentation today. Okay.
Okay, great.
So let's talk about the recording criteria. Any work-related injury or illness that meets certain severity criteria must be entered on the forms within 7 calendar days of learning about its occurrence. So you get 7 calendar days. We'll talk about each one of these in the next few slides, of course, but paragraph 1904.4 explains the overall process of deciding whether or not to record a case. All cases, both injury and illnesses, are analyzed using the same criteria. Illness cases are only recorded if they meet the same criteria as the injury case. Also, in that 1904, it includes a flow chart that provides a visual representation of the overall process for deciding whether or not to record an injury or illness. Okay. Now, OSHA defines an injury or illness as an abnormal condition or disorder. Injuries and illnesses include cases such as cuts, fractures, sprains, skin diseases, or respiratory conditions. For OSHA record-keeping purposes, an injury or illness can also consist of only subjective symptoms such as aches or pains. Exposures that do not result in signs or symptoms are not considered injuries or illnesses and should therefore not be recorded on the OSHA forms. For example, if an employee is exposed to chlorine and does not exhibit any signs or symptoms due to the exposure, the case would not be recorded on the log, even if it involved some type of preventive medical treatment. Let's talk about what's work-related. So this is, employers have sometimes struggle with determining what is work-related. Work-related is cases that are caused or contribute to or significantly aggravated by events or exposures in the work environment are considered work-related for OSHA record-keeping purposes. Work-relatedness is presumed for injuries and illnesses occurring in the workplace or in locations where the employee is located as a condition of employment. It is important to remember that if work makes any contribution to the injury or illness, it is considered work-related for OSHA record-keeping purposes. There are certain activities that occur in the work environment that OSHA does not consider work-related. For example, injuries resulting directly from eating, drinking, or preparing one's own food at the workplace are not considered work-related. And then you can get a complete list of those activities in that 1904.5 B2.
So, Anthony, I got a question about this significantly aggravated. So let's say that's a pre-existing condition somebody brings with them to work, and that pre-existing condition is not work-related, but then their performance of their job aggravates that injury. That brings it into work-related. Is that what I'm understanding?
Yes, and we'll talk about that a little bit. That must be a significant aggravation of a pre-existing injury or illness.
Okay.
Okay. So that brings, like Brooks said, it brings us to the next slide. When employees are at the establishment, they are in the work environment. When employees are working away from the establishment, they carry a bubble of work environment wherever they go. And then when we're talking about significant aggravation, there must be a significant aggravation of a pre-existing injury or illness to establish work-relatedness. The workplace event or exposure must aggravate a pre-existing injury or illness enough that it results in greater consequences than what would have occurred but for that event or exposure. This means that that pre-existing condition requires more medical treatment than otherwise needed, more restrictions, and more days away, etc. So if that injury causes that death from that pre-existing condition, or loss of consciousness, or more days away from work, or restricted more work, or more medical treatment, then that will be work-related.
All right, let me give you an example, Anthony, and you tell me. So, pre-existing condition could be something like an allergic reaction, anaphylaxis, or whatever. Somebody's out on the job, they get a bee sting while they're performing their duty. Let's say they're reading meters for, and they get that bee sting, and then they end up having to go because of their allergic reaction. They have to go seek medical treatment.
Mm-hmm.
Explain to me, what's the decisions there, and what is the employer supposed to do?
So as far as the treatment, well, the recordability of it, we're looking at it. Did that bee sting cause any medical treatment that wouldn't otherwise be there? Did it cause more medical treatment or more restrictions? And in this case, it may not be, because hey, the employee was already allergic to bee stings.
Right. But if they had
So
to if they went to the doctor and the doctor gave them a prescription, let's say.
yeah, if we consider that would be, if it's considered to be more treatment than it would be. Now,
Okay.
one of the things that I used to see a lot of times is, hey, somebody has arthritis in the hip, right?
hmm
And they slip and fall. Now, did that slip and fall cause your arthritis to be elevated to another level where now you got to have hip replacement surgery? Now that may be that's what we used to see a lot more. So, and then that may have been recordable.
And we had a question come up it's along the similar line. A question came up in the chat. It's if you had an employee with a known heart condition and they experience a heart attack and die at work, um, the question is it work related?
Now, as far as heart deaths at work with a heart attack, you got to report that to OSHA, whether it's work related or not. That's something that has to be determined. Did something in the work environment cause the heart attack? Now, if it was a personal medical condition, that would not be recordable. But now, if you get a employee that may have been exposed to some type of chemical that caused that, then now we're talking about is work related.
Okay, so there's
And
got to be some type of work condition that triggered it,
that triggered.
and whatever that trigger was had to have made the situation worse for that
At
person.
work.
Okay.
And one of the things that we used to receive a lot of times when I was with OSHA is, hey, you see somebody having a heat stress event. The first thing they think of, oh, he was on blood pressure medication. The employee had health issues. But then did the heat did the heat cause something? And that's where, in particular in South Carolina, in smaller counties, sometimes you didn't get a coroner's report to do an autopsy. They just go along with, oh, well, he had heart problems. So that was a struggle sometimes.
Great. Well, thanks for clearing that up.
Mm-hmm. Okay. Of course, with every rule, there are some exceptions. Uh, Cases meeting the conditions of the listed exceptions to work relationship in the rule are not considered work related and are therefore not recordable. For example, we talk about if a grocery store employee is shopping in the store after work and falls and is injured, the employee is present as a member of the general public and the case is not work related. So, all right. Likewise, we talk about symptoms arising in the work environment that are solely due to non-work related events. So we're talking about a diabetic episode and must be given prescription medications. The diabetes is solely due to a non-work related event or exposure and is not work related. Regardless of where signs or symptoms surface, a case is work related only if a work event or exposure is the cause of the injury or illness or of a significant aggravation to a pre-existing condition. For example, if an employee passes out giving blood or is injured playing basketball, the case is due to voluntary participation in a wellness or fitness program and is not work related. If an employee burns his lip or on a cup of coffee or chokes on a sandwich, the case is due to eating food or drink for personal consumption and is not work related. So some additional exemption: if employee uses the employer's sewing machine to make tents for the Girl Scouts after the shift has ended, this is a personal task outside of assigned working hours, and any injury that would occur doing that task is not work related. One of the things that we used to see a lot of times outside of work related is, hey, the employee may be using some equipment in the facility. In particular, hey, it's a saw or woodworking piece of equipment, and they may injure themselves using that outside of their working hours. But then sometimes it happens during their working hours. They'll be working on personal tasks. Of course, if an employee has a negative reaction to asthma medication for personal allergies, gets mascara in the eye, or commits suicide, the cases are from self-medication for a non-work related condition, personal grooming, or intentionally self-inflicted and are not work related. If an employee is injured in a motor vehicle accident going to or leaving work at the beginning or end of the shift, or for a personal errand, the case is not work related. However, if the employee slips on the ice in the parking lot or is in a car wreck doing business, the case is work related. If an employee catches a cold or the flu, the case is not work related. Mental illness is not work related only if the employee voluntarily provides the employer with a written opinion from a licensed healthcare professional with appropriate qualifications and experience that affirms a work-related mental illness. The employer is under no responsibility to seek out mental illness. In addition, the employer may also get a second opinion from another licensed healthcare professional and accept the opinion of the most qualified licensed healthcare professional.
All right,
So those are some, go ahead.
We have another question that came up that, so this question is more about like multiple things happening in sequence and how to record them. And so the question is, if an employee received treatment in an ER, let's say it's a minor cut, and then they have to go back 2 days later because it's still sore and they receive medication. And then if they have a bad reaction to that medication, the question kind of is, with this sequence of events, is this all considered one record that you go back and update a single record, or are these things supposed to be, if you have multiple events that are kind of all related, do they get recorded separately?
In that case, it'll be recorded once. You just have to update the record because it's all based on that one event that happened in the workplace.
Great. So if something happens in a sequence, then those things get lumped together, and you just go back and update the first record.
Correct.
Okay.
Let's talk about travel status. What's the working about travel statuses and working at home? So when employees are traveling, an injury or illness that occurs while the employee is engaged in work activities for the employer is considered work related. Travel to and from customer contacts and entertaining or being entertained at the direction of the employer are work related. For example, if an employee falls in the airport while on a business trip, the case is work related. When an employee checks into a hotel or motel, he or she establishes what they call a home away from home. While they're in that home away from home status, cases that occur are not work related. For example, if an employee slips in the hotel shower and is injured, the case is not work related. Likewise, if the employee takes a side trip while in transit for a vacation to go sightseeing or shopping and is injured, the case is not work related. Okay? When employees are working at home, a case is work related when an employee is injured or becomes ill while working for pay or compensation. Cases are not work related if they are related to the general home environment. For example, if an employee drops a box of work documents and injures her foot, the case will be considered work related. if an employee's fingernail was punctured and became infected by a needle from a sewing machine used to perform garment work at home, the injury would be considered work-related. But if an employee was injured because he tripped on the family dog while rushing to answer a work phone call, the case would not be considered work-related. Or if an employee working at home is electrocuted because of faulty home wire, the injury would not be considered work-related. Also, there was a time when OSHA, it was, will OSHA come out and do inspections at home offices. Right now, the OSHA does not have a policy to come out and do inspections at home offices.
So Anthony, I got a question for you. So earlier you talked about establishments, and that a record needed to be tied back to an establishment, which I'm, my understanding is you can kind of think of it as almost like a physical location.
Right.
Post-COVID, we have so many people working remotely and working at home. How do those people get treated on the reporting from that standpoint?
Those individuals are wherever they're based out of, that would be their establishment.
Okay, so if there's if the accounting department normally works out of the office in, Greenville, but this person is working remotely, then they could be tied back to that Greenville establishment for reporting purposes.
Yes, that is correct.
Okay.
All right. Severity criteria, of course, work-related injuries or illnesses that result in death, loss of consciousness, days away from work, restricted work activity, transfer to another job, or medical treatment beyond first aid must be recorded on the OSHA forms. Okay. Some general recording criteria, of course, restricted work activity. That's when an employee is unable to perform one or more of their routine functions. So also some routine functions are those work activities that the employee regularly performs at least once per week. Now, we've also gotten questions in the past. Well, the employee was injured and they could do one part of their job, but they can't do the other part of their job. Well, if you cannot do one or more functions, your routine functions, then that is a restricted work activity. Job transfer, that's when that injured or ill employee is assigned to do a job other than his or her job for part of the day. And a case is recordable if that injured or ill employee performs his or her routine function for part of the day and is assigned to another for the rest of the day.
So I got a question on on that real quick.
Go ahead.
So let's say that somebody, it's not, when do you determine if it's routine or not? So for instance, somebody does something once a week versus they do a specific job function, once a month.
Yeah, even if it's once a week, if they consider if it's part of your job duty, if that's something that you routinely do, and it does not matter the time criteria that you do it, but if you're not able to do that, then that will be a transfer of restriction.
Okay, so it doesn't the OSHA doesn't have like a frequency of it. It's just if that's part of your regular job, and you usually do that on the 15th, and the 15th rolls around and you can't do that, then in OSHA's eyes, that's considered a recordable.
Yep, that's recordable. That's a restriction. That's a restricted activity.
Okay.
Also, we're talking about day counts. When we talk about day counts, you use calendar days and you include weekends and vacations when you're recording the day counts for those injuries. But you do not count the day the injury or illness occurred. And one of the common misconceptions is people tend not to count the weekends. So make sure you count the weekends. And the days cap at 180 days. And when we talk about 180 days, that could be 180 days days away, 100 days are restricted, or a combined number of 180 days. And also you can stop counting if the employee leaves the company for reasons unrelated to the injury.
Hey, Anthony, could you go into a little bit more detail about is there any difference on counting if somebody, let's say, is part-time, or let's say that they're just they're just a flex worker. They just work, as needed.
No, there's no difference in the count days. The count is considering the days that they could have worked. Uh, and so it doesn't matter if they only work 2 days a week, 3 days a week. You count every day that they could have worked. So,
Okay, because we had a question that just came through. I think that just answered it. The question that came through was off shift counts as well. So example, 4 days on, 4 days off, you still count the entire 8 days, right?
yes, correct. Right.
And is there, I've always wondered this. I think I know the answer, but do you know why OSHA kind of looks at it that way, instead of work days?
OSHA looks at it because individuals work regular shifts, but if there was some other additional work that could be done, they could have worked those days. So OSHA just counting those, and they put a cap on that 180 days. So it's 6 months. They put that cap out there on that. So OSHA
Okay, great.
consider any day that could have worked, they want it to be counted.
Okay.
Okay. Let's talk about medical treatment. Of course, medical treatment is the management and care of a patient to combat the disease or disorder. Medical treatment does not include visits to a licensed healthcare professional solely for observation and counseling, including follow-up visits. Medical treatment also does not include diagnostic procedures such as x-rays, blood tests, or MRIs. Use of a prescription medication for diagnostic purposes is also not considered medical treatment. For example, prescription eye drops used to dilate the pupils. That's not considered medical treatment. Finally, medical treatment does not include first aid procedures. And we'll talk a little bit more about first aid procedures. Now, first aid is defined using a list of procedures that are all inclusive. If a procedure is not on the list, it is not considered first aid for the record keeping purposes. The first item in the list is using non-prescription medication at non-prescription strength. This means that if an employee is provided prescription medications or non-prescription medications at prescription strength, it is considered medical treatment. Okay. The rule also makes it clear that wound coverings such as butterflies, bandages, and steri strips are first aid. Use of a wound closure method such as sutures, medical glues, or staples is considered medical treatment. The rule also makes it clear that hot or cold therapy is first aid, regardless of how many times it is used. Also, non-rigid means of support is first aid, and those temporary mobilization devices used to transport accident victims is first aid.
Okay, I got a trick question for you on this one, Anthony, and because I've seen this question a lot in the past, and I think I know the answer to it. But you were talking about medication. Let's say somebody, because you mentioned prescription. So let's say that somebody did end up getting a prescription. What happens if they don't fill it and they don't take it?
Just because they don't take it, the healthcare professional prescribes that prescription for that injury, then it still becomes recordable. That's beyond first aid.
Okay, that's what I thought, because it was in the medical professional's opinion, it went above a first aid, and so it really doesn't matter what happens after that. As soon as that prescription's written, then that has to be recorded.
Correct.
Okay.
And a lot of times first aid, a lot Hot and cold therapy is used a lot in first aid to keep an injury from becoming recordable. That's why we encourage employers to have a system in place for employees to report injuries as soon as they happen. So first aid may be a way to keep it from becoming recordable. Of course, some other first aid items, removing drilling a fingernail or toenail to remove blisters. We're talking about eye patches, removing foreign bodies from the eye using irrigation or a cotton swab is first aid, using other methods to remove materials from the eye is medical treatment, uh, finger guards medical as first aid, massage therapy is first aid, physical therapy or chiropractic treatment is considered medical treatment, and drinking fluids for relief of heat stress is first aid, but administering fluids through an IV is medical treatment.
All right, Anthony, we got two more questions that came up real quick, so we'll go ahead and address those. I'll take this one first for you. This one goes back to the work relatedness questions. If an employee aggravates an undisclosed pre-existing condition, a pre-existing injury, while they're performing their job activities, but they signed a job description confirming that they're able to do that work, to do that job, is that work related and recordable?
Yes. It doesn't matter if they disclose it or not. That's why you see some companies have some type of, hey, some kind of programs to see if you can actually perform this job function. The OSHA does not say that the pre-existing condition had to be reported to the employer.
Okay. And then the next question is, this is an interesting one. What do you do for long-term recording? If an injury causes an employee to have days away from work, and that extends past the current calendar year. So, for example, that they gave was it happened on December 22nd, but they still have follow-up in January into like January 14th. Do you go back and update the previous year's log along the way? And they didn't ask this question, I'm going to add to it. Is there any circumstances when you would create a new record for the next year?
To answer your question is no, you do not create a new record. You go back and update your logs from the previous year. And just remember that it caps out at 180 days. And 180 days, and that can include combined restricted and days away from work.
Okay, great.
All right. Other recording criteria. So OSHA believes that most significant injuries and illnesses will result in one of the criteria listed. We're talking about in 1904, we're talking about death, days away from work, restricted work, or job transfer, and medical treatment beyond first aid or loss of consciousness. However, there are some significant injuries, such as a punctured eardrum or a fractured toe or rib, for which neither medical treatment nor work restrictions may be recommended. And that should be recordable. In addition, there are some significant progressive diseases, such as silicosis and some types of cancer, for which medical treatment or work restrictions may not be recommended at the time of diagnosis, or are likely to be recommended as the disease progresses. OSHA believes that cancer and chronic irreversible diseases, fractured or cracked bones, and punctured eardrums are generally considered significant injuries and illnesses and must be recorded at the initial diagnosis, even if medical treatment or work restrictions are not recommended or are postponed in a particular case. Also, OSHA looks at needle sticks and sharp injuries as some of those significant injuries. When there's some medical removal, when the employee has to be medically removed because of some exposures, hearing loss, and TB.
And Anthony, there's a couple more questions came up, but I'm going to hold them because I think you maybe have some slides that are going to address it. So I'll come back to those
Okay.
if we don't touch on them.
Okay.
One new one just came up. If after work-related injury, employee is first out of work for 3 days and then returns to work on restricted duty for 90 days, would you record the case as days away from work or restricted, which is more severe?
Yeah, you take the more severe. You'll record it as days away from work for 3 days, and then you also have 90 days. We'll talk a little bit about that, I think, right now.
Okay, great.
So, for cases involving a fatality, or of course, you enter a check mark in column G on the OSHA Form 300. No, in column M, whether the case involved, you note in column M whether the case involved an injury or illness. Also, remember that you must report the fatality to OSHA within 8 hours of learning of that occurrence. For cases that involve 1 or more days away from work, you must place a check mark in column H on the OSHA 300 and enter the number of calendar days the employee was away from work in column K. Then note in column M whether the case involves an injury or illness. When counting days, be sure to count the days the employee would not have been able to work, regardless of whether he or she was scheduled to work. This would include weekends and holidays. Do not count the day of the injury. And if the day count reaches 180 calendar days, you must stop counting subsequent days and enter 180 in column K. For those cases involving restricted work activity or job transfer, you must place a check mark in column I on the OSHA 300 form and enter the number of calendar days the employee was restricted in column L. You count the days in the same manner as counting days away from work. Then note in column M whether the case involves an injury or an illness. And of course, an employee is considered restricted if he or she is unable to work a full shift or is unable to perform all of the work activities he or she would be expected to do at least once. If a case involves both days away from work and days of restricted work activity, you place a check mark in column H. That's the days away from work. You leave column I blank and enter the correct counts in both columns K and L. For example, if an employee of course had those 3 days away from work and 2 days of restricted activity, you place a check mark in column H for days away from work, and you enter 3 days in column K and 2 days in column L. Again, note in column M whether the case involves an injury or an illness. So the answer to that question is, hey, days away from work is where you put the check mark in.
Okay. Right. So the answer then is if you have both days away from work and after that, which is pretty, I would think would be kind of common with somebody that's on this rehabbing or doing light duty. Then when they come back to work, if they can't go back to their full job with all their job duties, then that's when you would start counting that as in column L.
Right.
And I think this would be a good time to address the other question that came up earlier that I said I would get back to. And we'll figure out how to fill this form out. The employee cuts their finger. They have to have stitches. They miss the rest of the day. They return to work the next day. And so can you walk through how that's recorded? So,
and I think we're geared to just talk about that now.
Okay, great.
All right. Just so that's one of those cases that involve medical treatment beyond first aid. You must place a check mark on that OSHA Form 300 in column J. That's that other, which is for other recordable cases. Then note in column M whether the case involves an injury or an illness. So there won't be any days away from work or no restricted activity possibly, but you just check in column J for other recordable injury or other recordable cases.
Perfect. So in this case, they would mark J and they would mark injury. And then when that person came back to work, since they only missed the day of, they wouldn't be any days away from work because the day of doesn't count.
Yeah,
And
correct.
then as long as that person with their stitches could perform their full work duties, then they also wouldn't have a job transfer. But if
Wouldn't be
they,
no restrictions or job transfer.
right, but if they did come back and let's say that for 2 days their doctor said, you can't bend that finger because we don't want the stitches to come undone, so don't use your right hand, and they're right-handed, then we would count that if they couldn't perform their full duty with their left hand.
If they could not perform their full duty.
Okay.
Correct.
Okay, great.
Right. And then, for those, that medical treatment that is any treatment for an injury, illness, except those diagnostic programs. That's so if you got that medical treatment, but then we also have already talked about what would be considered first aid. So, okay. Some other requirements. So that subpart includes other requirements. It's telling the employees how to handle multiple business establishments and temporary employees, and how to summarize and store the data. For multiple business establishments, you've got to keep that separate OSHA Form 300 for each establishment that is expected to be in operation for more than a year. It talks about covering employees. It excludes self-employed and partners. So course, it talks about the annual summary that must be posted from February 1 through April 30th, and it requires certification by a company executive. And OSHA wanted that to be done because they wanted the company's executive to the highest level to understand what type of injuries are happening in the workplace. And then there's talks about retention and updating that OSHA logs, they must be maintained for 5 years. And then the OSHA 300 log must be updated for 5 years.
Okay, Anthony, I'm going to stop you here because this goes back to the other question that I was holding because I thought there was a slide on it.
Mm-hmm.
What do you do for your electronic records? Are you expected to go back into the portal if you file electronically and update those records as well?
You mean when you're reporting back to OSHA?
Yeah, so let's say that let's say there's updates like for 2 or 3 years. Do you need to go back and you've already submitted everything electronically? Are you expected just to keep those updates at your um, locally, like where you're keeping them on a day-to-day basis, or are you expected to go back into the portal and make updates?
Unfortunately, OSHA hadn't established where you can go back into the electronic submission to update that. It's usually they open it up on January the 2nd and then they close it on March the 2nd, and you can't add or update anything. I don't know if they've correct that problem or added some additional controls in it, but it's usually the electronic submission portal for that year shuts down on March the 2nd, after March the 2nd.
Okay, and so just to make sure you're covered, you'd want to manually keep that updated for 5 years.
Yeah. Yes,
Okay.
you keep your records updated for 5 years. Okay. All right. Subpart D also includes what to do if a business is sold, employee involvement, state plans, and variances. Employees must inform employees how to report an injury or illness to the employer. Employers must establish reasonable procedures for reporting injuries and illnesses and must inform employees on the procedure for reporting. Employees' right to report work-related employees have a right to report work-related injuries or illnesses. And this is a very basic step to make sure employees report cases so they can get into the record. Employers are also required to provide the records to employees. The logs are available to employees, former employees, or employee representatives by the end of the next business day when they're requested. Of course, employees cannot be discriminated against for reporting a work-related injury or illness, and there are some other discriminations, filing a safety and health complaint, accessing their workplace records, nor any other employee right under the OSHA Act. But this does not ban drug testing of employees. It only bans employers from using drug testing or the threat of drug testing as a form of retaliation against employees who report injuries or illnesses. In addition, employers cannot create drug testing policies or incentive programs, practices that deter or discourage an employee from reporting an injury or illness. Let's talk about employer reporting fatality or severe injury. Of course, all employers who are required to notify OSHA when an employee suffers a fatal injury on the job or work-related hospitalization, amputation, or loss of an eye. That fatality must be reported to OSHA within 8 hours. An inpatient hospitalization, amputation, or loss of eye must be reported within 24 hours. An amputation, how does OSHA define amputation? An amputation is a traumatic loss of a limb or other external body part. Amputations include a part such as a limb that has been severed, cut off, amputated, either completely or partially. Fingertip amputations with or without bone loss. Medical amputation resulting from irreparable damage. Amputations of body parts that have since been reattached. Amputations do not include those avulsions, degloving, scalping, severed ears, broken or chipped teeth. Inpatient hospitalization, that's that formal admission to the inpatient service of a hospital or clinic for care or treatment. Treatment in an emergency room is not reportable. All right. Who is required to electronic report those injuries and illness records? So this is what we're talking about. Those covered establishments. That's any establishment that's currently required to maintain OSHA 300 forms with 250 or more employees during the calendar year are required to report electronically. Establishments with 20 to 249 employees in certain high-risk industries. And you can find those industries in Appendix A of that 1904.
Hey, Anthony, real quick, question came up regarding this. I'm going to try to keep it really brief because I know we're starting to run out of time a little bit. We got like 8 minutes left, and just want to be, want to respect everybody's time, but I want to get this question in right here because this is where it belongs. Is the question was there's a lot of companies don't electronically report even though they're supposed to. How does OSHA find out about that? What do they do about it? And what are the fine categories that apply? What type of fine category applies to that, if you know?
Well, OSHA has enough. They use a lot of technology to determine, hey, who should be reporting and what to report. And the OSHA also looks. They've created some targeting programs based on who they think should be reporting. They use a lot of data information to figure that part out, and then they use that targeting inspection process to say, and it could come up, hey, if you don't report, you may get an OSHA inspection.
And then you said earlier at the very beginning that when a compliance officer is going to make a visit to a location, they're usually pulling these records, and so they'll know before they get on site if they don't see that they've reported electronically. Is that correct?
If they fall under that category, if you go to the OSHA.gov website, they may, I don't know if they have that directive listed out there. They got what they call a site-specific targeting program, and that's where they look for those industries. They use that data to, hey, We're looking for the non-reports. They're looking for industries that have high reports, or some industries that may be some companies that may be underreporting. Now, they use that program in the federal government, but I don't know if all state plans are using that program for their inspection scheduling. South Carolina currently is not.
Okay.
And then also for electronic reporting, if you're an establishment with 100 or more in certain industries in that Appendix B. So there's some general history about when all of this rule came out in 2016. That's when it started. And then in 2019, the final rules published when it eliminated reporting the 300 and 301 information. And then came back in 2023. Some establishments with 100 or more employees in some of those specific high hazard industries must submit that more detailed information. And then also establishment must include their legal company name when making their electronic submissions. That came out in 2023. And then they also made that injury data publicly available. And so they removed some of that personal identifiable information would not be published. And then some key dates for that electronic reporting is January the 2nd. It opened up, you can report your 2025 data, and it closes March the 2nd, 2026. And like I mentioned, that site-specific targeting, site-specific targeting that's OSHA's main site-specific program inspection initiative for the non-construction workplaces that have 20 or more programs. And you can probably find that information on that OSHA.gov, that site-specific targeting program.
All right, and I have one more follow-up that came in from the chat. Is do you if somebody doesn't report, if they don't follow this, do you know what fine category applies, or can that change based on the circumstance?
I know I have not seen what OSHA would put a fine on those right now. I have not seen any violations of this where there's a fine. And OSHA doesn't mention it much in their field operations manual. I do know that they can go up to whatever the highest penalty that they have in that state that they can look for those. But I haven't seen any state plans or any violations of not reporting with a penalty. Normally, if they come out and you're not reporting, they're gonna do a full inspection of your workplace.
Okay. So a lot of times you're saying it doesn't really drive a fine, but it is considered, and it could be written up in other than serious.
So when OSHA uses that, when they're compiling their data and looking at all the data, and they find out a specific site did not report, you may get on this site-specific targeting plan.
Okay. But they can fine, but they usually just
they can, but I haven't seen any
Okay.
fines out there related to it as of yet.
Okay.
Mm-hmm. All right, and that's it, and that's how you use that injury tracking application login page. And that's it for me, Brooks. I don't know if anybody have any additional questions or how much more time we have on this.
We're pretty good time. We got a couple more minutes. So we did have another question come in. So if the employee calls out sick the day after an incident, but the doctor did not put them out, they just took off sick on their own, is that considered lost time?
No, it has to be done by a licensed healthcare professional.
Great. And does anybody else have any questions they want to put in the chat real quick? Or I don't see any more questions coming in, Anthony. Listen, I really appreciate everybody's time. And Anthony, appreciate your expertise on all this. And we'll make this available. George, did you want to give any information about how people can access this after this is done?
Yep, it'll be posted to our YouTube channel next week, and we'll be sending out follow-up emails with the address for that video to everyone in attendance.
Great. Really appreciate everybody. You know, I know these deadlines are coming up pretty soon. You know, if you have any questions or anything we can help you with, please reach out to us. We're happy to try to help you out the best we can and make sure that you stay compliant. And thanks, Anthony, for your expertise on all this.
Thank you so much. If anybody has any questions, please reach out.